guys, so we'll get started. I just want to introduce our speakers today. Thank you so much for coming. I really appreciate it. This has been an evolving partnership between Denver Housing Authority and Denver Public Health and the Stroke Foundation for continued work together. So this is Isaacson, and some of you may know her. Oh, you know, the left one. And you can see why I will be crying at the end of this because Abby's moving to Seattle. Abby, really? I know, we just got her, and Melissa. But she has been indispensable in helping with this analysis and this report. We will be presenting on the evaluation that we did for Denver Housing Authority. And also, where are we? Sorry. I want to introduce Lynn Picard, who will be co-presenting. She is the Workforce Development and Community Initiatives Director for Denver Housing Authority. And we have Elizabeth in the room, who now works for Denver Public Health. She did actually work with Abby and myself when she employed at Denver Housing Authority. So we do have a lot of people who worked on this. I was hoping Joanna Wilkinson would be here because she was part of this effort. At Denver Public Health, Jen Moore and Bill Berman, of course. And at Denver Housing Authority, Elizabeth Rumble, Shana Burkett, who's not here. Unfortunately, you said she couldn't come. We got the overlook today. Got it and split up. Okay. And John. I have to mention John. I'm so sorry. Yeah, not this John. No, John Young. John Young. Lots of Johns in the picture.
Yeah, and this work is funded by the Colorado Health Foundation, and so the evaluation we did was helping to provide outcomes to them. Covering a little background, which Lynn will come up and present about Mariposa, about the neighborhood and some of the redevelopment that have been there. Cover how we did our evaluation design, and then the outcomes we saw at a project level, intermediate, and long term. And some of the things to the evaluation, some conclusions and recommendations to Denver Housing Authority. At the end, we'll open it for questions. So if you do come across anything you're about evaluation, you can ask me, and Lynn will be available about Mariposa. So with that, I will. A little bit on Mariposa.
Morning. They told me left on this to do the clicker. There is a great chance that I will mess it up. What we're doing today is what started as a 270-unit public housing development. It is 10th and Mariposa, so it's just south of the Auraria campus. It's on one side by the train tracks, and then Santa Fe and Calumet on the east side. And the south side of the neighborhood is about 6th Avenue, between 8th. Okay. 270 units of public housing. As you can see, when we started this process in 2009, we had some very serious physical distress in the property, which look at the redevelopment. In addition, we had issues in the neighborhood. At that time, there was a very high crime rate. There were issues with employment. So our first step at the Housing Authority is we create a master plan. It becomes a guiding document for the redevelopment of that neighborhood. We look at transportation. We look at utilities throughout the neighborhood, recognition for the people who live in the neighborhood, different types of housing, not just public housing, but are there homeownership opportunities? Are there, market rate rental or affordable housing? We take a look at all of the social aspects of that neighborhood as well. In 2009 and 2010, I worked on this project with Kimball Krangle. We joke that her and I spent more time together than we did with our own families because we were out. We had, in 2 years, 140 community meetings or with the people living in the South Lincoln Development, steering committee meetings, we office where we kept the plans, and so people could stop by and look at them. They can make comments on suggestions in public meetings and coming to anything from what kind of amenities they wanted us to help put into the neighborhood to the design of the buildings. We really put into effect a true community process where the design of our senior building, where we make, honestly, the process makes architects a little uncomfortable because they like to come in and they like to hand us and say, okay, you told us you have this much money, this is what I can build for you. Well, they brought it in and we asked the senior and disabled folks who are going to live in that 100-unit building, what do you think? But it has a case of, and our elderly folks are like, that's pretty, but I can't walk in there. No, we put an elevator back here. And people went, you're going to be here Saturday night when I get home from my son's house to take me to the elevator back here, you know? So the building ended up with, much residents love it. It's much conducive to elderly and disabled folks. So it's not as pretty with the grand staircase, but input from the people who are going to live in that building is essential. Let's see. So the information we gathered from the process in 2009 and 2010 led us to work with a group out of, actually, and they said, to look at something that originated out of San Francisco called the Redevelopment Measurement Tool. And what it does is it looks at the entire neighborhood, not the physical health of the people living in it, but access to other cities, transportation, housing, employment, support services like childcare, access to be able to have physical activity. So health impact assessment, and the impact that we got fed into the Healthy Development Measurement Tool. So the impact assessment and the needs assessment that we did after the community process found that similar to what I read about in low-income, high-minority neighborhoods across the United States. Unfortunately, what we got for results was exactly what we expected. High city rates, there was in the neighborhood, people didn't feel safe living there, that many people were exercising, and I mean, even though there's a rec center right in that neighborhood, there's a very large park right there, people were utilizing it partly because they didn't feel safe. Over 60 or 65% of our folks did not have access to a car and transportation. They used bus. Information from the Healthy Development Measurement Tool and created something called the Mariposa Healthy Living Initiative. There are 6 different categories from that create a healthy neighborhood. Environmental stewardship, safe and sustainable transportation, social cohesion, public infrastructure, and healthy economy. I can't read all those little things, but if you really want to know, there's more on the DHA website. So we took these things, and it became a community-invested process, not just the people who live in the neighborhood, but the people who lived in the neighborhood as well. So the people who spent time in this neighborhood was somehow connected to make this change. These are some of the things that we did. So we went to Colorado Health Foundation and some communication saying, okay, so we are going to redevelop this, but we'd like to honestly try some really cool things here. And the Health Foundation said, it's a placemaking strategy. We think it's an excellent idea. So we hired 2 employees, one, now that you guys stole from us, makes me cry just a little. But healthy living coordinator, and we have a patient navigator. So work with the Mariposa district and work in getting people aware of programs and getting them involved in programs and getting them involved in healthcare and changes to their lifestyle. In addition, one of the things the Housing Authority did, which we've done before and was very challenging, is we developed our physical property, staircases, we have gardens, we have the bicycle, the bike share, we have 2 stations in the neighborhood. We did a walking path, we put a fitness zone in the park. Into the social elements, we really looked at some of the built environment and those in there. To stairways, would have known it. If you put wind in a stairwell, you make it wider, you high elevator, more. It increases community because then you talk to your neighbors as you go up and down the stairs. So just changing where we put this and how we built them has made an entire change in the neighborhood, or just one of the things. So the Health Foundation, we have active design, which is what I just talked about, the educational programs. And part of the reason we're here today is we've tried to track that because we came up with an idea and said it was a great idea doesn't make it, unfortunately. So that's where Denver Public Health came in and said, okay, let us help you prove that what you have done has needle. Okay? So we can use this process. We can say that this process makes sense in our future redevelopment. Okay? We have over 500 units, where we were at 270. We have over about 500, I want to say 523 units of mixed housing now at Mariposa. We have 1/3 is public housing. We replaced all of our public housing units, one replacement, so affordable housing was lost. We increased affordable housing because 1/3 are tax credit units, one market rate. We are a little behind, so we're should be moving within the next 30 days is what they tell me. Phase and Phase 8 are about 12 months out. Our last phase, Phase 9, we're actually selling some of the land to private developers so that it will be it'll be probably a for sale condo developed in the neighborhood. Now there isn't a lot of that, so expecting working that in the next 3-4 years. So how, and I'm going to turn over to Abby so she can put all the fun and exciting information. Thanks.
Switch back. Okay. So, we started with the interventions that Lynn was speaking of in the built environment, healthy and active living programs, and the patient navigator, which we call health navigator interchangeably. And follow that all the way to the bottom right square, we can see we're hoping to see long-term outcomes in tobacco use, health utilization, and chronic disease prevalence. And all I'm talking about today is going to be improvements in healthcare utilization and chronic disease prevalence, those last two. Tobacco use didn't have any significant changes that we were able to document, and BI was difficult to assess because of some of the changes in the survey and how it was asked. The health survey didn't ask about gender, so that kind of precludes looking at BI, and then some of the other questions, weight or BMI. So yeah, we're working on standardizing the survey so we're able to track that. We could possibly record data down the line as well if we wanted to see what like over our grant period. Audit. So both staircases, we looked at one active and one inactive staircase, and we observed ascents and descents. We did 2 community surveys. One, the Mariposa is a one-time survey available to any resident that we could find. And the TAPI's annual survey was a health-specific survey just at the building that houses the elderly and disabled residents. And that's called TAPI's. And it was 3 years of data that we were able to analyze. We did with staff and 7 residents. Secondary data. I would say the most helpful was the Mariposa log database, which is what Elizabeth and John tracked and kept track actions with residents and what they participated in. And then we did Colorado Hospital Association, census time. We took a look at those as well. So who completed the surveys? It's Mariposa Neighborhood Survey. There were 1 valid responses, people whose complete survey were able to use. And the TAPIs, we had over the 135 responses that we looked at. Overall, in middle-aged population and White, Black, and Hispanic were the dominant racial groups that participated. And just an interesting note, when we looked at the demographics, at TAPI, so the elderly building, about 100 units there, I believe, there was a change in who filled out the survey. If it's representative of the population, we could possibly say that White and Black residents are surpassing Hispanic and multiracial populations in that building, and that might be representative of the neighborhood. I don't know, but we do know gentrification is happening there. So it's just interesting to see that reflected in the TAPI survey as well. To process outcomes, just who's using the amenities that are being built in. The highlights there, I would say, we're going to go through them, but the health navigator and the program coordinator really are and work and impact there. To look at the first set of data, the health navigator, and these are available across the but he was housed in TAPI, so a lot of the time it was directed to elderly and disabled resident building. So he's 63% of TAPI's residents, and male and female and older, which makes sense, older residents, 6 and older, that's basically who lives there. Among the 37% who did not use his services, 8 had reported that they just didn't know about him or they hadn't a need for his services yet. And I recently spoke with him to interview him on the next project, and he said, oh, it's at least 80% right now. I've reached at least 80%. There's interactions with residents. I'll just highlight on this slide that mental health and activities of daily living are where he spends most of the time. That's hours and then interactions with residents is how we summarize. Most of it are additional services or follow-up with appointments, substance abuse referrals, advocacy, healthcare access, like going to appointments with residents and taking them there sometimes, and also the smoking cessation. So if we look at just the top one, the mental health aspect, where he had the most interactions with residents during the grant period, we broke it up by type of service that he provided, and just to get detailed. But most of the people that he helped, he had them access what we gift baskets or encouragement gifts, baskets of joy, roses on Valentine's Day through Veterans of America, just different projects that would encourage the residents in their mental health needs. The most popular were social activities like spring flings and Easter egg hunts and the like. Interviews. Everyone was really supportive and responsive to talking about his services, and they named primarily just the relationship, the trust, a listening ear that he provides, and they use the words kindness and consistency as descriptors. So you can see that not only are they providing services, but health navigators have the opportunity to build relationships with the residents. So this is Elizabeth's area. Another highlight of our process outcomes were the programs that she provided for residents of healthy eating, health education, physical activity, well, youth initiatives, and employment and cooking. So this was from September 2013 through the end of 2015. The first point, healthy eating, was the majority of residents' time of what they participated in. Again, you can see how we broke down types of participation. And most were Denver Botanic Gardens Farmers Market, which was a weekly farmers market that's free to residents. All the produce was donated. And in a key informant interview as well, one resident said she has no idea why it's not crowded full. I mean, there were a lot of people when I observed, but she goes, I talked to all my friends, and they don't want to come down, and I drag them down to the farmers market. So that's definitely a highlight, as well as the health education programming. The amount of time spent off programs. The most popular was called Heartbeat is Life. It's a cardiovascular disease prevention course and management over 8. And the second most popular was healthy aging activities like fall prevention and bone health. We did this process with all of those talks I mentioned. I'll just highlight verbally, like in physical activity programs that were offered, the most popular was yoga. 66% of residents do yoga. And it's interesting, a lot of them are trapeze, elderly and disabled residents, and yoga is something that was really simple for them to participate in. And that was, 66% is pretty high for some of the data. And 10% did walking clubs. And one of my key informant interviewees, she had said, like, I never thought about walking as like something fun. And when she did the walking clubs, she stopped after a while, but then she just grabbed her friend and like her buddy from the building, and they just walk every, whatever regular area, I can't remember. But she said for the walking clubs, they wouldn't have even thought about doing a regular daily thing. And then for wellness activities, there's a class called Estara that's very popular. 54% of residents participated in. It's like a holistic and culturally sensitive, like personal healing class almost, or different set of courses. And they did accomplish their Kitchen Q goals of the cooking class. She wanted to implement that the foundation was wondering about, and they did have 18 participants in that. And we looked at a number of other amenities that are just built around the neighborhood and not as intentional. So they did have 20 raised bed gardens that were built in 4 different sections of the neighborhood, pretty much with every phase of development. I think there are new gardens built. And another key informant interview said that was the primary positive influence on her health, was her ability to tend one of the gardens. You might even know who she is, I don't know, but she said she's out there, like, she'll take as much space as possible, and she'll tend other people's to make sure their produce doesn't die, because she feels like having her own organic, vegetables right there, like, actually feel better. She was talking about her physical health, like, feel better. There was a co-op kitchen also built into another phase, and the intention was to have common space, communal meals, sell produce, even implement meal programming. And I thought that the consensus with that space is that it was easier for CAF residents to attend programs and classes at the cafe, which is right next to their residence, and it's a lot easier for them to get to the co-op kitchen. There hasn't been a lot of programming in the kitchen. There were 2 communal meals offered, but besides, they're looking for kind of innovative ways to use that space. You did the programming they had planned in a different location. So, speaking of, is free out exercise equipment in Lincoln Park. And we found that, again, this is from like a one-time neighborhood survey. 32 Mariposa residents reported using it. How often? That was about half once a month or less, and about 30% said twice a week, and most 46 to 65. The that I spoke with about it, he said he wasn't aware of any exercise equipment available on properties, like, had lived there a year and a half. I said, well, do you know about the Lama Recreation Center across the street? He's like, we need a recreation center downstairs. Like, well, there's one across the street. He's like, I don't know. And it's like, have you seen the fitness zone across the street? He's like, I don't know what that is. So, there's people who stay in their little worlds no matter what. But the people who commented in our survey about not using the fitness zone had said that they either know about it, they preferred another way of exercising, like they had a gym membership, or they attended a free gym somewhere else. They knew how to use the equipment, or they felt uncomfortable having people watch them exercise outside. We looked at transportation signs, so there were 12 new streetlights, a new bike path that connected to the other bike paths throughout the city. This sign that you can feature, and also was designed in one of the phases. You can see a design photo there. We actually have a picture of it, but it was covered in snow, so I thought this would be more useful. It's a space for families to use, so if there are elder grandparents kind of the floor of some of the things surrounding, then they're watching their grandkids. They don't have to trek all the way over to Lincoln Park. They can just come right outside and have pedestrian path, a rubberized path, a bike path that does a little loop. There are gardens there. There was a compost that moved to a different place. So it's a cool space. Is the greenhouse functioning there, or is it there still?
Yeah, the greenhouse is open and functioning, and the Botanic Gardens is seeing it
Cool.
with our residents.
Yeah, so there's a lot of cool space there. And then we asked about Lincoln Park, even though it's nothing new, it is a place where people are going to be getting activity. And so it was the highest, 80%, it's not the graph up there, but 80% of respondents said they use the park primarily for exercise. 73% said for exercise, and 4% from that's who mostly uses the park. We thought we'd ask about safety as well, because for all these surveys of time, we're tracking how safe people feel and capacity in the neighborhood. And so we'll in a minute with the longitudinal data, but staff have felt very safe when in this particular context at the park. And the active staircases, there are two that were installed. One's called a whimsical staircase. It has this 40-foot chandelier you can see throughout the middle. It's accompanied by music and lights and a storytelling of like Mayan culture as you ascend the staircase. Like, who would not want to go up the stairs, right? And it was in 2013, and then another building has a mural, pictures from Lynn's last presentation, but murals all up throughout the stairs. So what we found at Wednesday morning, Wednesday afternoon, and Friday, or Wednesday and Friday afternoon, and we did ascents and descents on one of the active, and then another active staircase, just a normal staircase, another building. And through 300 different observations, we found that more residents still use the elevator. So far, this is a very limited observation. I would say we could probably do some more surveying, but it were used for descents most commonly. But in terms of people ascending, Friday afternoons, people would use the stairs, and so it was interesting to take a look at all of that. Some more term outcomes. We're looking at intermediate now. This comes from our TAPI survey, the annual health survey over 3 years, and some secondary sources. I think of the report. We saw a significant increase in the ability of those who could see a doctor in the past year when they needed to, a 48% increase, and and older were able across the board to still be able to see a doctor when they needed to, which I think is interesting. People listed for not able to shifted from cost to transportation, which I think is good. That's a fixed transportation issues than cost, but the increase of seeing it at ages 46 to 55, but they started at 100% of always being able to live in a smaller group. So if a few people weren't in the last year, it went down to 75% from 100, but I don't think that's anything really too much attention to. So another outcomes that are not as significant but are related to seeing a doctor were healthcare coverage. Who were able to have healthcare coverage? It was 94% in 2012 and 97% in 2015, which is great. All of these results, what role does the Affordable Care Act have in some of these outcomes? Because it was in 2014 is when it was rolled. That's right in the middle of all this. And so we'll be discussing that at the end, but how much is facilitated by these great amenities? It's hard to comb through that. And to this that was interesting were the respondents who were always able to afford their prescriptions increased about from 59 to 67% in 3 years. And even more interesting, those who were never able to afford their prescriptions was down 55%. So there's a lot of promising trends happening here. Those weren't significant, but I think it is saying that there's some change happening. Second highlight of our immediate outcomes were health conditions and those who've been diagnosed or ever told that they had certain chronic diseases. So we saw a 37% decrease in asthma rates, those who've been diagnosed with asthma. Not all of these were. Let's see, decrease in blood pressure, diagnosed with blood pressure, but that still remained, high blood pressure still remains the highest concern among residents, according to the state of TAPIS. This is the elderly and disabled building. And then diabetes increased by 21% in diagnoses. Also accompanied by a 400% increase in prediabetes diagnoses, but you're starting at 2% and up to 8%. Is that a result of more people seeking care, or is it a result of more people starting to have diabetes? So things that we aren't reading about, but we've talked to Lynn about this too, looking at prediabetes as a focus for some of those interventions. Outcomes that were significant. I just wanted to point out those who ranked their general health as good increased by 21%. Just see any increase in excellent health rankings. Again, we're thinking of the population that we're in. I'm not sure a lot of elderly and disabled consider themselves ever in excellent health, but we did see the good rank go up. And those who not smoke reported not smoking increased from 70 to 76%, which is good. Wasn't significant. And then we see clear outcomes in exercise. You see some variance in how we're exercising, 17% more reported at the rec center, but the frequency was difficult to pay off with just their overall habits. I would say that chronic physical barriers were common. People just kept saying, I can't, I have a hip problem, I have this, I have that. And so that might be some of the inconsistency that we saw with exercise. And then took a look at safety. So neighborhood versus Lincoln Park. Lincoln Park, residents are feeling safer walking in Lincoln Park, and their comments about why safer or it's unsafe or decreasing. And then neighborhood, more residents feeling safe. Oh, it doesn't change. So it should be, oh, that's okay. Basically, 96% feel safe in their homes all 3 years. So TAPES is doing a great job of building up that needs assessment goal of like feeling safe in your neighborhood. But common, like lots of negative responses and comments about substance use and homelessness and gang activity preventing them from feeling safe going to the park. So we know it's still a concern. Some secondary data we saw over the grant period, well, this is a little before, so 2010 to 14, we did see in crime, especially personal and societal crime, simple assaults, forcible sex crimes, and societal with drunkenness and disturbing the peace. Those things increased like 600%. We did see a decrease in property crime, which I think is interesting considering there were lighting improvements and like just efforts to make the neighborhood safer. I don't know for sure if that's what has been causing any of the property, like fewer burglaries and fewer car thefts and thefts from cars. So that all went down. Finally, poverty is just helpful as a social determinant of health, as it points to health outcomes. If you notice that there was a poverty decrease in 35%, and that wasn't every group equally, but overall 35%. And then if we look at the racial ethnic breakdown, Filipinos and Native Americans experienced an increase in poverty over that time. Or what's explaining that, but there is increase or improvements in distress that assessment. All right, so comes based on what might, all things that have been happening in Mariposa, what might be reflecting that. We only really looked at emergency department visits, and we would be hoping to see a decrease if more people are seeing their doctor. That's not the case. We found about a 25% increase over the period in visits from the Lincoln Park neighborhood, in just 3 years. So we thought, well, could we look at this data like by chronic disease diagnoses? Maybe the people who are visiting for chronic diseases has gone down, and we didn't really show what was happening there because there wasn't much happening there. It was very stable. It was hard to tell with small numbers. It was hard to tell if visitors or hypertension, were up or down. So we thought, okay, let's look at behavioral health. Well, Teresa thought about all this. Let's look at behavioral health visits, and we did find that behavioral health is comprised of the greatest burden among these residents compared to chronic disease. There was a 92% increase in mental health visits. That's the blue bar, actually. 1% increase in substance relapse. And overall, like if we added up all the behavioral health visits compared to chronic disease, it's greater, like 1,600 visits versus 200. So obviously there's something with mental health and substance use that's from Lincoln Park. It's great focusing on that. But that's what the data was showing us with the longer term outcomes. Are more people having behavioral health problems, or is the result maybe of less tolerance in the neighborhood of those types of behaviors, or it could be a myriad of different factors. Conclusion. We're looking at cross-sectional data, which can't be linked to the same individuals over time. We couldn't say anything really about migration. The numbers were too small of what was of who's coming in and out of the neighborhood. So we don't know how much that affects the longer-term outcome. Surveys differed a little bit here and there. We used all the data we could that was the same, but there were some gaps in, like, there was some data collected that we weren't able to look at. The active staircase, you don't see that being a problem for residents. Go, what is that? Nobody can answer that question. So in the next round, we'll say, well, are you using your active staircase? That is blah, 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 So self-bias, how much do you trust, residents filling out their survey that what they're saying is truly happening? Limiting, and again, the Affordable Care Act is doing some of this. We would say that the Healthy Living Program Coordinator and Health Navigator are residents, also achieving the Foundation's outcomes, and also addressing its needs assessment goals. If we're thinking about that was on Lynn's slide of stress and reducing health care, opportunity eating, and also some activity. We're getting there with exercise. That's really being addressed. Impacts exactly are unclear. We see that there are improvements in those areas, and ability to see a doctor, to access to healthcare, and then chronic disease diagnoses. Our recommendations included recreational exercise for those who are physically healthy and those who have physical barriers as well, a separate set of programs for them. And prevention and services for pre-diabetic residents. Everything that's available. Workshops, the fitness zone, farmers markets, and gardens. Especially in Lincoln Park, continues to reduce smoking rates. Safety features, especially at the intersection of 10th and Mariposa, and then standardizing the resident survey. So I'd like to bring Lynn back up, and we can spend another 10-15 minutes on questions if you want, based on the report or the neighborhood. And then here's just a little map that where the just can I field any questions? Information. If you don't really care with that much detail, I'm like, I can see who didn't eat. Yeah, I'll go back to the picture. This is there we go. This is what it looks like in life.
Yeah. It me several times over the. This is just a comment, Abby, about the staircase evaluation. There may have been. We didn't have any pre data.
Yeah.
We can say that yes, people really did use the elevator more. I think are valid because we saw every night they more than any other time period they took the elevator. Mm-hmm. But there really may have been an improvement. We just didn't have the data.
That's a good point. Mm-hmm.
So, did you guys take into account the increase in the population in that neighborhood? Because some of the data that I looked at, it's prime data, not the survey data, but the one that was taken from the neighborhood, because we basically the population. So, does that contribute to the increase?
Well, that rate, it certainly. For example, for chronic and for chronic disease visits through the College Association data, seeing the number go up. I'm sorry, Abby,
Go-
I'm answering
no.
for you.
Go.
How the number go up? Yeah. Yes, the burden is going up in the summer. So, for example, for the public disturbance was going up. So rates generally standardize to a degree that.
Yeah, population changes. Yeah.
Okay.
Well, and to think about the one-time neighborhood survey, the Mariposa one was done first, or right by the first Tepees one. It was an early survey. And, by the third year of Tepees, there could have been a lot of changes in the neighborhood that if we did that survey again with the whole neighborhood, it would have reflected something else too. Done at the beginning, kind of what that snapshot was like early. I forget what phase was completed when it was done, but yeah, some changes that will if we ask again.
Well, we updated a health impact assessment, and we saw, in addition to the poverty going down by those different stratifications, we saw other economic indicators improving. So, there's this whole component of gentrification. And I'm sorry that Joanna Wilkinson isn't here with us because we were doing some intercept surveys in Lincoln Park, and we actually spoke with some who were telling us that they and some of their friends had some neighborhoods to make the and think that there was gang activity there. And when we were looking at the public disturbance or the crimes against society, we did strongly feel that that was probably the new Canadian of drunkenness and shenanigans. But do you, or then do you want to also comment on what happened in that neighborhood? Did you receive an award for or was the fastest growing tracts in the United States, and Mariposa was one of them?
The Mariposa, the Mariposa District, Lama Lincoln Park neighborhood was one of the top 10 neighborhoods in the United States. I can't remember. Planning for putting in amenities, for building to a public health plan, for the community involvement. We're all finalists in, I want to say, was it for the best neighborhood in the U.S. We're to a neighborhood organization. So one for professional actual organization, but then also one a neighborhood organization. So she presented at that conference.
Thank you. You were saying too, Teresa, about the lack of tolerance of the folks that were coming in. Something that tried to educate around the folks that live there. Report people doing drugs or doing what outside, but they said, well, this is where this is my culture, and you don't snitch on your neighbor. I think that contributed to a lot of that unsafe space. And then once we started bringing in market rate folks, they said, building outside, that's not okay. I'm going to call the police. And they would respond to it. So I'm not surprised that we see an increase in reporting because the culture that you didn't talk about things, especially to public authority.
And there were several other neighborhood things that happened during that period of time. Of when we started right around the beginning, between when we started and now, they started camping band downtown. And the folks that were normally at Civic Center, because my over on Lincoln Park, so very increase in the homeless population in that neighborhood. Is that how it works, but we can have it in effect because it's
So you have a master plan, the master plan?
That's correct.
CHA learned, what would you do differently? Do you have the communities that you're doing the master plan in? And then, what would, and then I'd also ask the public health people, what would.
That's a very good question. So we actually are moving on. So I would say, for getting towards the end of building at Mariposa, but certainly not at the end of this. I think we have a ways to go with that. We need to show that, make sure, because like I said earlier, just because I think it's a good idea, unfortunately doesn't make it so. But we've seen some we're moving the needle in the right direction. So redevelopment community is Sun Valley. So Sun Community is the first neighborhood in the state of Colorado, probably a neighborhood in the state of Colorado where children under the age of 18 outnumber the adults in the neighborhood. 90% of the housing is affordable assisted housing in that neighborhood. There's 26 freestanding homes. Everything is assisted housing in that neighborhood. Of the Bronco Stadium, north of 6th Avenue, between 1 and Federal. So if you've been there, you probably get invited a million times, you didn't even know it was there. So we are looking at a similar approach. What now is we did a planning grant, so we have a master plan. We are pleased with the community involvement piece, but one of the things is getting involved earlier. So that a survey that, when we do the health impact assessment, we're, Denver Public Health on the onset. So we're getting the correct data. We're actually putting in a proposal next week. So hopefully for that. All right. Surprise. But the biggest thing is involving the people who evaluate this data from the beginning. And honestly, we didn't know back then. We know we're going to need metrics. We know we're going to have to collect data. But without some of that data, what is data? It's just because data, it doesn't mean it's usable. And so we have to tweak it a little bit. So the one that we want to do is involve Denver Public Health from the onset. So we're looking at this community actually has San Santos. There's a health clinic in that neighborhood. There's services in that neighborhood. So this neighborhood, we expect we're going to be doing the HDMT and the Healthy Living Initiative. But we do expect it to look different than the one at Mariposa because this neighborhood we do expect the things, some of the health issues to be the same, but a lot of the amenities in that neighborhood may look different.
That's a good answer. I was actually thinking a little bit more about this, what described as gentrification and the challenge of this is a neighborhood, it's the here, and this is a new home. This is that. How do we try to anticipate that kind with each how you could have that happen even before you get this on my wall or I'm taking your wall.
Mm-hmm. Yeah. But it's certainly something to take into account because that's something, honestly, that's something we are there. I actually just got back from DC from a conference. They just started a couple years ago. Universities in Chicago mixed income housing. They have a center on mixed income housing. And so that is one of the things that my plan is to do in the next year is to look at that data, look at any studies they've done so that we can anticipate and look forward. Because honestly, it's new to us. There's only, we did, a Curtis Park mixed income, but we built it off to a management company. The next we did it and we provided services, but then when it was done, we have a management company and we don't have a large presence there. This is a around going, we need to see if what we're doing is working. We need to see long-term, not 12 months after we move everybody in. That really need to take a long-term look at what we're doing. And so we are going to be taking a look at mixed income communities and how to, address that up front.
Maybe somebody's, done well.
Exactly. And that's what because mixed income is everybody across the nation has been mixed income for about 10 years or so. So my hope is that there's information out there.
It's a great question, and I love having this discussion before it happens, because you could then plan to look at some of this and understand it more. We may have spoken about this before. There's a neighborhood in Denver called Rhino, that some of you may know of it, and essentially a whole pile of artists took over these abandoned buildings down on Brighton and Larimer. Now it's a hot place, and now the artists are getting forced out, but they are rallying on their own behalf. The city is considering some kind of subsidize, or I don't know what that agreement looks like, but maybe moving forward, DHA might be able to get some examples of how the park being displaced doesn't have to be displaced.
Well, and when we do redevelopment, and I can't say this about all places, I can say, when we do redevelopment, when we have to move somebody, then the first right of refusal to come back. So always come back to that neighborhood. Now, and one of the things across the country, you have a % return. Okay? Because, if any have kids or families, if you moved and you're 3 years in your new place, and then I come knock on your door and say, hey, we're ready, you want to come back? The school system, they new friends, you've made new friends, you know the grocery store. You know what? I'm good. What we did at Mariposa, which is different, is we did a phased redevelopment. We expect that people are connected to the community that they live in, so the schools go to. Came to us during this redevelopment and said, you know what, my family lives here, I don't want to move out of this neighborhood. You didn't have, we didn't stand. It thought would come up. It was more expensive for us, but 40%, over a 40% return rate. So way above the national average. But with that, allowing people to not be displaced if unless to. Now, with public housing, we also have to keep in mind somebody in that neighborhood were living in that neighborhood because that was the only apartment we had available at the time. So, in your car, and we say you can live here, we live anywhere else. You're gonna move in here, and then you and say, okay, where would you like to live? Because when we're redevelopment, that's what happens. We move to whatever neighborhood. So if you live here because it's the only place we had available, but you're on the north side, when we move to the north side. So that's why I said that some people aren't going to come back. But we have a 40%. We're actually pretty proud of that. But they're still there. 40%. But because of the staff, we were very lucky to have. Shana, Elizabeth, Veronica, we had consistent staff there for the years, so they really were engaged and
So, to address the second part of your question, so we as evaluators, what we would like to do moving forward, it is, and Linda and Abby and I have had discussions about this, of standardizing the survey. And then other things that make it not so cross-sectional. So how long have you lived in this residence? And then we could potentially track people over time. The other thing is coming on board earlier. I think that I started on this project about 6 months after you guys got going. And the other thing that I think we could discuss with Emily is looking at forest area for private. to see. And of course, this whole thing is funded by the Affordable Care Act. But I think moving forward, we have a good foundation because now we really understand a lot of the systems and DHA and how they work. And what I read is that now I have Abby to help me. Somebody else.
Yeah, that's kind of our regret. Yeah, he didn't tell me. Sorry.
Take Elizabeth and now Abby.
Let it go.
I'm not down here.
No, we are looking at the health there are 2 new health navigators who are trying new housing residences. So Thomas Bean and Hirschfield just got health navigators, and we're looking at that through September, the end of September, through the Denver Foundation to see what kind of impact they're having. It won't be as extensive as the whole neighborhood, but some data and a report at the end of September on just their 2 of their roles in those residences. See if there's consistency with this data. Thank you.